Hi, my name is Olivia Quimby. I'm a student nurse at the University of South Alabama, and today I will be doing an indwelling catheter checkoff. Now you're going to scan the room. Okay, so upon entering the room, I'm going to perform hand hygiene, and then I'm going to verify my order with the hospital policy, and then I'm going to identify the patient by using two identifiers. I have my order form and the patient's wristband. So we have Jaguar Jones, date of birth, August 25th, 1963, August 25th, 1963. Mr. Jones has an allergy to penicillin, and he has a penicillin wristband. So I'm also going to note three different reasons why we're doing an indwelling catheter today, and these are on the order form. Those reasons are require immobilization for surgery, trauma, or other therapies, strict urinary output monitoring as indicated by plan of care, and to assist in healing of open sacral or perineal wounds in incontinent patients. So now I'm going to explain the procedure to the patient. I'm going to provide privacy, and then I'm going to gather all equipment needed for this procedure. So first I'm going to don my goggles. And then I'm going to move the trash can, position it where I need it, and this is where I need it for the procedure. Now, after touching the trash can, I'm going to wash my hands. So now I'm going to adjust the patient comfortably in their bed. I'm going to raise the bed to a working height, lower the side rails, and then I'm going to position the patient into dorsal recumbent position. So now I'm going to put on my clean gloves. All right, now that I have gloves on, I'm going to verbalize perineal care for both male and female. So for a male, I'm going to have the patient lay in supine position. I'm going to lay a towel underneath the patient's penis. I will grasp the shaft of the penis, and I'm going to clean from the urethral meatus inward and then outward from that. I'm going to rinse and dry, and then I will take a new washcloth and I'm going to wash the shaft, the scrotum, and the skin folds, and then I will rinse and dry that as well. For the female, I'm going to first take a cloth and I'm going to wash the labial majora, and then I'm going to retract the skin folds of the labia, and then I'm going to clean either on both sides and then down the middle of the urethral meatus from the peritoneum to the rectum. This patient, or the female patient, would also be in dorsal recumbent position, and yeah. So now I'm going to dispose of my gloves. And I'm going to take my catheter care kit out. Discard this. So now, before I'm going to open this, I'm going to position it away from the patient. This will be between the patient's legs. So now I'm going to don sterile gloves. So now all of the contents in this are sterile. So I'm going to take my sterile drape out, and I'm going to place it so the shiny side is on the bottom, and I'm going to place it in between the patient's legs. Tuck it underneath. Okay, so now I'm going to make sure that there's no gaps and I do not contaminate during the procedure. And I'm going to take my tray and place it closer to the patient. So now I'm going to take out my betadine swabs for cleaning and discard the package. And I'm also going to prep my lubricant. So now I'm going to take the balloon, the water syringe for the balloon, discard the cap, and and I'm going to connect it to the balloon port on the catheter. Okay, now that that's secure, I'm going to take off the catheter plastic wrap carefully so that the tip of the catheter is not contaminated. And now I'm going to lubricate. Also, I could have been at risk for breaking sterility by dropping it underneath my waist. So I would typically redo that, or if I did break sterility, I would redo gloves and get a new kit, but I know that you shouldn't drop your hands below your waist if you have sterile gloves on. So now I'm going to lubricate the tip of my catheter. And so for a female, I would lubricate 1 to 2 inches. For a male, I would lubricate 5 to 7 inches on the tip of the catheter. So I'm going to set that in the lubricant. And now I'm going to provide perineal care for the patient. So if this patient were a male, I would have them lay down in supine position. I would grasp the shaft of the penis, and I would clean from the urethral meatus inward and then outward. Now for my female patient, I am going to clean the labial majora, then I'm going to retract the labial folds, and I am going to clean with my betadine swabs, each fold going on the right one first, then discard, and then the left one. I'm cleaning from the peritoneum to the rectum, and then down the urethral meatus. So now I would explain to my patient that during this procedure, I would advise them to bear down as if voiding. Then I'm gonna tell them to breathe deep and slow breaths during insertion. So if this patient were a male, his penis would be perpendicular and slightly trapped. It would have slight traction. So now I am letting my patient know that I'm about to insert the catheter, and I'm going to insert the catheter, and whenever I see urine return, for a female, let me provide some slack. For a female, after I see urine return, I would insert 1 to 2 more inches. Then for a male, I would insert all the way to the bifurcation. So now I'm going to stabilize with my non-dominant hand, and I am now going to insert my water balloon, my water syringe, and this will inflate the balloon inside the tip of the catheter. So I'm going to do this and apply pressure. I'm going to detach my syringe, and I'm going to normally discard, but I'll set this aside for this procedure. And now I'm going to tug on the catheter, making sure that it is intact, and then I will push away to relieve pressure on the bladder neck. So now I'm going to put on the stat lock. This is a safety precaution to make sure that the catheter is not pulling on the bladder. And so I will unclip it, and I will connect it at the bifurcation, like so. Do it this way. And this will go on the patient's inner thigh. And before putting this on the patient's inner thigh, I would take an alcohol swab and I would clean the inner thigh first, and then I'm going to place it on the inner thigh. And I'm going to make sure that the arrow is facing towards the patient's abdomen. So now I'm going to take my drainage bag, and I'm going to hang this bag on the, make sure that sticks. I'm going to place this bag on the bed frame, not the bed rail, and it should always be below the patient's bladder. Make sure this works. The stat lock would normally be on the patient's inner thigh and would remain there. So now I'm going to verbalize what I would do for a sterile urine specimen. And so I'm going to have a sterile container. I'm going to uncap it and keep the lid facing upward. I will place it right here. For the drainage bag, I'm going to detach the port, and I have a towel and a basin out on the floor to collect any splashes or urine that falls. I'm going to make sure I don't touch the tip to the sterile container. I'm going to unclamp it and put it into the container, and then I'll reclamp it once I have my urine specimen collection, and I'll put it back in the bag. And then I would recap like so, and then I would put a label on it and send it off to the lab. Now for the second part, this is another option. I will recap it and set it aside. I'm gonna put this down. This is the port entry, the port version of the drainage sterile specimen. And so I will clamp it first, and then I'm going to take an alcohol swab and I'm going to clean the port. I'm going to discard. I'm going to take this plunger and I'm going to apply it to the port, and I'm going to draw out as much urine as I will need for this specimen. So now I'm going to inject it into the sterile container, making sure I do not touch the sterile container or create splashes. I can discard this. Now I'm going to recap, and I would label this on the container and then send it off to the lab. So now I'm going to discard this as well. I'm going to unclamp and make sure that there is urine flow to the bag, drainage bag now. So the reasons for doing these two, the difference between the two is the drainage bag, I would take a sterile urine specimen if the catheter was immediately put, the indwelling catheter was immediately put in the person. I would use the port method when the catheter has been in the patient for a couple hours or a couple days. So now all of this, I'm done with all of this equipment. I'm going to remove all of this. I'm going to set this up here. I'm going to remove all of this, and for the sake of this video, I'm just going to set it aside. I'm going to remove my sterile gloves, skin to skin, glove to glove. And now I'm going to lower the bed to the lowest setting and raise the side rails. I'm going to ensure that the call light is close to the patient and that they have all comfort equipment that they will need for just being in the hospital. So I'm now going to perform hand hygiene, and then I will document. I'm going to document the catheter size, the amount, the color, the consistency of the urine. I'm going to document how the patient tolerated the procedure and the sterile specimen, or the specimen container or specimen collection. I'm also going to do daily catheter care with soap and water, and then incontinence, and then after incontinence of stool. I'm also, as medically indicated and as soon as possible, I'm going to remove the catheter just as a measure because we don't want it staying in the patient for too long. So now I'm going to take out the indwelling catheter. So this is an aseptic technique, so I will have my goggles on, which I do, and then I'm going to put on clean gloves again. Okay, so the first part of taking out the indwelling catheter, I'm going to drain all of the rest of the urine in the drainage bag. And I would do this in a graduated cylinder, and I would measure all of the drainage. So now I'm going to remove the stat lock. It should still be on the patient's inner thigh. I will secure it by taking off the lock mechanism, and then I'm just going to remove it. And so now I am going to deflate the balloon for the drainage port. So I'm going to take my syringe that I used earlier. I'm going to pump it to making sure it works well. Going to retract it back to 0.5 milliliters. And I'm going to put it on the balloon port. And gravity should pull out the drainage, or the water in the balloon at the tip of the catheter. Almost done. Okay. So now that all of the water is drained out, I'm going to make sure that it is all out. And now I'm going to gently remove the catheter from the patient. So now I'm going to discard of all of this, and I'm going to provide perineal care for the patient. And then now I'm going to remove my gloves. And I'm going to document. So I'm documenting for the amount, color, type, and odor, and the characteristics of the urine. I am documenting for the intactness of the tip of the catheter and the amount of water that was taken out of the balloon. I'm also noting the patient's tolerance from the procedure, and I will also teach the patient three symptoms of a UTI, which would be frequency, urgency, and dysuria. I'm also going to plan to come back every 4 to 6 hours because if the patient is not voiding, I would want to palpate the bladder and then obtain a bladder scan. Thank you.